The key findings were that HPTN 067 demonstrates that single, young, Black African women at high risk for HIV infection in South Africa can take and adhere to PrEP. Most women preferred daily dosing. Daily dosing was also attractive to men who have sex with men and trans women in Bangkok and Harlem. The Bangkok participants also demonstrated that non-daily dosing was feasible, and they were able to achieve high levels of adherence and high levels of drug and high levels of coverage of sex events. The high levels, the success of non-daily regimens in Bangkok suggests that this may be a feasible option for some MSM and trans women. MSM and trans women in Harlem, New York, however, did better with the daily arm. They achieved higher levels of adherence, higher levels of coverage, and were able to stay on the program longer. Our qualitative research findings are also very important. The team led by Revea Miko found that medical mistrust is common in many of our communities and creates social and internalized conflicts when medical services are offered. These conflicts create a dynamic psychological and social situation that is full of hazard and opportunity. The situation causes some to withdraw from services and others to become champions for new prevention and treatment technologies. Understanding this dynamic and meeting people's needs during these times is a key to disseminating both treatment and prevention technologies and controlling the epidemic. While many participants, another finding is that while many participants preferred daily dosing, they wanted to be able to change their PrEP program and start and stop PrEP as they needed and as their sexual lives changed. There are seasons of risk driven by changes in relationship status, housing status, and employment, among other events. People want guidance about how to start and stop PrEP as they move in and out of seasons of risk. Situating PrEP and other medical technologies is really a key to advancing their uptake and achieving high adherence. We identified many perceived advantages and disadvantages of PrEP dosing regimens that will help us develop good clinical practices that aim to maximize the appropriate dissemination of PrEP and its integration with treatment initiatives.